So I'm going to go over the side effects of oxaliplatin chemotherapy in combination with radiation for your head and neck cancer, something that we reviewed already. Potential side effects certainly can include hair loss and fatigue, and also a drop in your blood counts. The drop in your blood counts can include your white blood cells, which help us fight infection, the red blood cells that help us with energy, and the platelets that help us clot blood. Now, every time you come in, we're going to check your blood, and we'll get it back before you get your chemotherapy in case I need to make any adjustments. Other side effects can include a risk of infection with a drop in your white blood cell count, and we'll want you to check your temperature, and we want you to call us at any day, any time, if your temperature is over 100.3 degrees Fahrenheit. There's always one of us on call, so you'll be sure to be able to reach one of us. We may prescribe you antibiotics at that time if we feel that it's necessary. With the drop in your red blood cells as well as your platelets, you may need transfusions. Most of the time, this is not common, but it can occur. Most of these transfusions will be done as an outpatient, so you will not need to be hospitalized for those. Other potential side effects can include nausea and vomiting, but you're going to receive pre-medications before every dose of your chemotherapy to prevent it, and you'll have prescriptions for home to use at any time. People can have diarrhea with their chemotherapy. They can have aches and pains in the muscles and joints, and certainly with the combination of radiation, you are going to have some degree of mouth and throat sores with your treatment. It's going to be important to let us know when it's becoming more and more painful so we can prescribe you the appropriate pain medication to help relieve some of those symptoms. Because of that, you will also notice a decrease in your appetite and a harder time eating. This can lead to weight loss. We're very, very careful about the weight loss because we don't want individuals to start losing close to 10% of their body weight. If we see that is occurring or going to occur, we'll talk to you about various strategies to help improve your appetite and oral caloric intake, but also need to talk to you about the possibility of having a feeding tube placed so we can get you the calories that you need. This will be very important because it's these calories that are going to help you heal faster when you've completed all your treatment. Other potential side effects can uncommonly include rashes as well as blurred vision. Oxaliplatin also has unique side effects as well. Oxaliplatin can cause numbness and tingling in the fingertips and toes, and also can cause a cold-sensitive numbness and tingling. This means that, for example, when you put your hand into the freezer or grab some ice cubes, as your fingers get cold from the ice cubes, they begin to develop numbness and tingling. You let go of the ice, your hand and fingers warm up, and that tingling and numbness goes away. In addition, oxaliplatin can cause an unusual side effect that is best described as an oral esophageal weird sensation. No easy way to describe this, but basically what happens is that if individuals on oxaliplatin eat or drink something ice cold, they have this very unusual, sometimes uncomfortable sensation going down the back of their throat, down their esophagus. Nothing's happening. Nothing is burning, nothing is swelling, and nothing is closing off. It's just very unusual and uncomfortable. Best way that I've been told to describe it is simply weird. What we recommend is our individuals start their food and liquids at room temperature and then work their way up or down, as it'll be different for everyone on how cold one individual can tolerate.